Thank you for joining us on this broadcast. As I mentioned today, we're looking at two facets of conversations. One to do with tourism, the other to do with our healthcare workers. Now, before we get to the tourism conversation, let's take a look at the impact of COVID-19 around the world. And the numbers this morning stand at 266,126,068 confirmed cases globally, 239,708,952 have recovered, and unfortunately 5,270,696 are reported to have succumbed to COVID-19. In the country, as per the Ministry of Health, 255,437 is the number of confirmed cases within the country. 248,426 are reported to have recovered, and we have lost 5,335 people to COVID-19 within the confines of Kenya. Now, Tunisians say they are not afraid of the Omicron variant after the first case was recorded in a Congolese man who arrived from Istanbul. Now, the 23-year-old man tested positive, and all fellow travelers on his flight from Turkey were contacted by Tunisian authorities to be tested as well. The Omicron variant was first announced by South Africa, but has since been discovered to have been present earlier in Europe. It has prompted governments around the globe to reimpose travel restrictions despite warnings from the World Health Organization that this could do more harm than good. And still on the pandemic, Health Cabinet Secretary Mutahi Kagwe has urged politicians to use their platform during public meetings to mobilize their supporters to go for the COVID-19 jab. The CS, who spoke at a school's funds drive in Kisii County, appealed to political leaders to ask their supporters who attend their rallies, mainly the youth, to ensure they are vaccinated. He said the decision to close off in-person services in public offices and premises to non-vaccinated people is the last resort. Now, Kagwe asked Kenyans to embrace the jab, noting that even foreign nationals traveling to the country were also required to be fully vaccinated.
Na mimi nawasihi wanasiasa jameni, kabla hatujaanza maneno ya siasa, kila mkutano tunaeleza watu tafadhali nenda upate chanjo. Kwa sababu chanjo ndio inaweza saidia wewe ukipata corona, ukiwa umechanjwa pengine unaweza ukawa hai. Kwa sababu ukiwa hujachanjwa na upate hii virus, wewe anza kuandika mambo mengine kwa sababu mambo haijulikani hapo sasa.
Away from that, and Kenyan athletes ran a 10-kilometer race in Iten, a high-altitude training hub in the west of the country, for top runners in homage to long-distance running star Agnes Tirop, who was found dead at her home on October the 13th, barely a month after she broke the world women-only record in the 10-kilometer race. Now, Tirop's death threw a spotlight on the pressures faced by the country's female athletes, who pay a huge and often tragic price for their spectacular success in a male-dominated society.
Wenye wako na mashida tujaribu tutatua kwa njia ya uzuri, si kwa ubaya.
Haikuwa kitu poa poteza mwanariadha hodari kama huyo. Saa ningeimisa ikwe, yani bado tusidulumia.
Since you all know what happened in August, it was really bad, and we thought that it was important that we reach out to the athletes who are the majority of the young people around Iten and Elgeyo Marakwet County.
To show the commitment of the national government and the government in general in ending gender-based violence. It's unfortunate that the people who bring us glory, they lost one of their own, as we all know about the later Tirop.
So let's now focus on our first conversation of the day. This morning, we are focusing on the tourism sector. To help us along with this conversation is actually the Kenya Tourist Board CEO, Dr. Betty Redier. Thank you for making time. And as I mentioned, I mean, tourism has really been on the spotlight, especially during this pandemic. Let's talk about how we have been doing. Now, when we started off 2021, I remember there was a study that showed or said that Kenya's hospitality sector growth was projected to remain neutral due to the impact of COVID-19 pandemic. We're in December 2021. How are we doing?
Thank you, Gladys, and I'm glad to be here. Well, we have done not what we had projected, i.e. neutral, but the effects of the pandemic have been severe for the industry. And we've seen almost a 73% decline in our numbers in Kenya. And almost 80% decline in revenue generation from tourism. And that is just from 2019 to 2021. Now, if you look at this, in terms of the impact of the pandemic, it has been severe for the industry. The industry is slowly recovering, very slowly. And if we look and project when we perceive that there will be full recovery, we're looking right far out to about 2024. So the effects of the pandemic, because they continually change, related to the different variants that are experienced not only in Kenya but around the world, it has meant that any projections that are made is merely a forecast, and not really a projection. Because with every change comes a different permutation to what happens in terms of travel and in terms of tourism.
Okay, so there is no time, especially in this year, where we saw sort of an upsurge in the market?
So one of the things that happened following the opening up of the air space, as well as the opening up of the counties, basically travel between one county and another, we saw at least an initial surge in terms of people electing to travel. And this was because people had been at home for so long, almost 9 months, since the pandemic has started, 6 to 9 months. And therefore, we found that people were ready to go out, but cautiously. So we saw a brief surge as we opened the market, the airspace is opened. We began to see a trickling of people beginning to move around. As we move towards the festive season, which usually is a bumper period for the industry, we are hoping that we will see a much better uptake. Obviously, with the recent announcement of the Omicron virus, that is going to create a bit of apprehension in travel. But talking to our stakeholders in the private sector, they've seen good uptake and good bookings for the festive season, and we hope that this will be upheld.
Now, you just mentioned that people were keen to travel after staying at home for so long, meaning the pandemic taught us the value of domestic tourism. How has that impacted on our fortunes?
We in Kenya had focused on domestic tourism from as early as 2018, 2019. And what we had seen during that time is an immediate uptake, and domestic tourism we measure by bed nights. So already looking at the 2018, 2019 figures, we had seen an upsurge in bed nights to about 4.5 million. And what that showed us is there was a latent market, a domestic market that we could mine. What's happened, however, globally is with the pandemic, people have been very apprehensive and cautious about traveling, and therefore the natural thing to do is to travel fairly close to your environment, and that usually is domestic. So that's no different for us in Kenya. The market has seriously been sustained by domestic travelers, and we thank Kenyans for having taken the cue and the opportunity to travel. We believe that is going to continue to be the case in the immediate term. We've begun to see a slow uptake of travelers from some of our key source markets, namely the US particularly, because they have been a lot more bullish in terms of going out long haul, for long haul travel, a bit of growth in areas emerging markets, and that has been mainly spurred by charters, and we've seen that from the Ukrainian market and the Romanian market. But Europe and the UK are still very tentative in terms of their decision to travel.
Now, coming back home, still focusing on the fact that Kenyans saw a gap in the system. First of all, the prices went down, giving a lot of Kenyans an opportunity to literally tembea Kenya. And the question is, how are you leveraging on this? Because Kenyans also discovered much more than just the coast.
Exactly. The thing about Kenya has so much more to offer. And apart, the prices, put the prices aside, just as a destination, we have amazing opportunities. And one of the initiatives that we took up in 2019 was to curate these opportunities under a banner called Magical Kenya Signature Experiences. In the initial year, we launched 15 of them. The way these experiences are curated is a collaboration between ourselves as the tourism board and the private sector stakeholders. We invite them to share what they perceive to be an experience that can be a signature experience. The signature experience is born of an experience that is, first of all, export ready, in that it has all of the infrastructure, but it's also an experience that helps people to have an opportunity to see another aspect of the destination, either in adventure or in luxury or in wellness. And we've gone as far as having homestays, even just experiencing how it is that it feels to live in a farm, water sports, those types of experiences. And therefore, Kenyans now, over 2019 and 2020, have at their disposal 44 curated experiences. So first off, because we knew Kenyans were used to going either to the coast or going on safari or going up country, because that's an experience as well, we took the opportunity when we had a tension of people looking for places to go to almost prescribe the opportunities that our destination Kenya has to offer through these 44 signature experiences. And therefore, as people look to travel, we urge them, don't only go to the coast, which you have gone to a number of times. There are amazing experiences there, and I'll talk about that in a bit. But there's also other opportunities as are provided by these signature experiences. When we come to the coast, we looked at the coast brand in totality and developed what we call the Kenya Coast brands, and there's 7 destination brands. Namely Malindi, Watamu, Lamu, Mombasa itself, and then Kilifi. And what those did, and also Savo. What we did with that is it allowed us to almost spotlight the opportunities that are available in the different coast brands that people can experience. So don't just go to Mombasa. You can go to Watamu, you can go to Diani, you can go to Malindi, you can go to Lamu, and they're a different experience that is not just about sun and sand and sea. It's so much more. It's culture, it's heritage, it's water sports, it's conservation, it's marine life. So those are the things we want Kenyans to just consider even as they go to the coast.
Okay, now let's go back to the cost of doing business. Of course, there was reduced private sector lending as most lenders pulled back or ceased the new lending to businesses, with the Kenyan hospitality industry not exempted. So how has that impacted on the industry, and how are we recovering to ensure that at least you can give some footing to some of these businesses?
So the industry was fairly hard hit because this is an industry where literally the business closed. The government was gracious enough to provide, through the economic stimulus package, opportunities for flexible funding, and this was done through an economic stimulus package with concessions on interest for the industry, specifically for refurbishment and improvement of the product. This saw an uptake from the industry to try and, during that COVID period when they didn't have that much travel, relook at their products, try and revamp and refurbish those products. But also there was a collaboration between ourselves in the Ministry of Tourism and Wildlife and the Ministry of Labour to try and see how we could make concessions around tax, especially individual tax for employers, to try and help them sustain the employees that they had. Most of our private sector players were able to retain staff albeit at a reduced salary package, but it was to urge our partners to keep their staff on, because with the pandemic, everybody was facing a crisis in terms of income, in terms of economic capability.
And we're still in the pandemic. It's just that we felt there was a bit more heat in 2021. And still on the same end, looking at the foreign market, now that we know a lot of countries, as you've mentioned, are cautious about their travel, and with the new variants also bringing greater concern, how are you now strategically placing our brand to ensure that we can woo them in?
So one of the things that every destination needs to consider when they're looking into tourism and hospitality is your readiness in terms of your health and safety, but more specifically the protocols that you have in place that help the consumer, because that's really who your customer is. The consumer feel comfortable to come to your destination. So one of the things that we did really early on is develop the Magical Kenya tourism protocols, and that was in early 2020. And what that did is it provided a framework under which industry is governed, but also a framework that is available to the public to see how it is that our stakeholders are readying themselves in terms of the safety and health protocols within establishments, within tour operators, and within our parks, to make sure that a visitor and even a Kenyan traveling around Kenya feels safe in that respect, that there are COVID protocols that are in place. So that was the first thing. Most destinations, that really needs to be right at the front. Health and safety needs to be right at the front in terms of opening up. Then secondly, we as the tourism board have begun to look at strategic partnerships, both with airlines, with like-minded operators in market, with our mainly online travel partners, and also just looking at the digital space and opportunities of portals such as Expedia there's Expedia and there's, I forget the other one. So that help you to just get a sense of what people are doing and how consumers are searching, and ensuring that you're right up front in terms of a destination that is available for search. The other thing that we did is during that period, there were many people at home. And one of the things that we realized is there was a lot of time spent on social media and on the digital platform. What we did is we embraced virtual tours within the destination. We're able to live stream over that period safaris around the Mara and around some of our other parks to help people continue to keep the destination top of mind. Over and above that, we partnered more recently with a partner like TikTok, and we're able to actually live stream the migration in the Mara. And what that does is it helps the destination to remain alive in people's minds, and therefore when they are ready to travel, you rank right up there in terms of destinations for consideration.
And now Kenya featured majorly at the Expo 2020 in Dubai, which I remember the theme being connecting minds and creating the future. Was this a strategy to woo them in?
It is one of the strategies that we have, and this is something that is going on. The Expo 2020 Dubai goes on until the first quarter of next year. What an expo like that does for you, unlike the usual exhibitions that we went for, which are 3 or 5 days maximum, is it gives a destination an opportunity to actually showcase a number of different aspects, both in trade, in investment, in tourism, in preparedness now, because health is important, and even in areas like agriculture, and it helps not only visitors that are looking at the destination for leisure, but also visitors that are looking at the destination for business in terms of investment, looking at the destination for partnership, and those types of things, and looking for people in the destination that they might be able to do business with. When you have a prolonged opportunity like what the Dubai Expo 2020 provides, is it allows people to make to plan and make that choice to actually visit your stand. If you prepare yourself well enough, it is really a good platform to be able to present the destination.
And we're talking about the impact beyond the pandemic. There's some countries that have given travel advisories to their citizens. For example, the US, the UK at some point. How have we dealt with this, and how has it impacted on us?
I think travel advisories, in most cases, especially in the face of a pandemic, tend to be slightly ill prepared, because it's dependent on the host country's view of the impact of the pandemic from different countries without a lot of information. So one of the things we've done as a destination is ensure that we, first of all, are very transparent in terms of the interventions that we have in the destination concerning the pandemic. We have, from the beginning, and we thank the Ministry of Health, been able to be very transparent about our numbers in terms of infections, in terms of recovery, and in terms of hospitalizations. What that does is the perception for the destination is that we are open and present to the fact that we have a pandemic, but it is something that we need to manage as we go across. So you find that when we look at markets, in fact, when there's an advisory against your market, we take time to understand what is the information we require to ensure, to help you understand that we are prepared, or that we have put in place measures that ensure that our tourism and hospitality industry can continue. What are some of the expectations you want your consumers to understand in terms of coming to the destination so they feel safe? So all of the measures that we have at the point of entries, all of the measures that we have when they go out into the destination, and what our partners have put within the establishments, either in hotels or as they travel around in the parks. All those measures work towards helping consumers, and not only that, but governments in different destinations classify where a country like Kenya would be in terms of safety.
Okay. All right. So even as we go into the second festive season, unfortunately, we're still within a pandemic. So how do you see this panning out and encouraging more people to actually sample what Kenya has to offer?
I think, first of all, I'd mentioned earlier, I'd like to thank Kenyans, because when you're in Kenya, you understand the measures that are in place. So you're less apprehensive. And what we found is that Kenyans are really embracing the destination. And the point that we have made around Tembea Kenya and Kenya in Anitosha has actually worked really well, because we found that people are now exploring what haven't I seen, which county can I go to, and the whole issue around evolution has helped people make the decision that says, I haven't been to this county, what does it have to offer? Within that context, we have worked with counties to develop what we call top experiences. And those are experiences within the county that have potential to become signature experiences, but are still in the infancy stage. And we work with these counties who have identified these experiences to move them forward so that in the future they do actually become signature experiences. In the meantime, Kenyans are able to enjoy these top experiences, especially if we're able to partner with the counties and bring some awareness around these experiences. It helps a Kenyan say, instead of just going to my home county, which I'm used to, I'll try and go to my neighbor's county.
Okay. Now, if there's a reality, and I think I mentioned the same when we were starting off, is that the school calendar has also thrown us off a little bit. We literally have around 10 days between closure and the next opening of school term. And in itself, it talks a lot about how much people can even spend on their holidays this time around. What would you suggest or advise Kenyans to look into, so at least you can stretch the budget but still stay within the same?
Okay, so I think one of the things that most avid travelers know is early planning. Now at the moment, that's a bit late because we're already in December, but we encourage people to try and plan slightly earlier. But over and above that, there are a lot of fairly close experiences that people can have. That are, if you're in Nairobi, there's experiences that you can have 1 or 2 hours away or 3 hours away. There's experiences within Nairobi that you can have with your family. But also we urge people in the counties to figure out what can we do within our county, especially since the school calendar has made the holiday season fairly tight. It means that in terms of movement, you want to limit your movement to in and around your locality, and if you had planned early, then you will be the recipient of fairly good value, even if you decide to go to the traditional either Mombasa or a safari. So the point we make is that the opportunity to experience the destination is there. You just must be open to exploring. You can come onto our website, which is magicalkenya.com, www.magicalkenya.com. We have offers there that show what opportunities our private sector have provided to Kenyans to consider over the holiday period, and it's for different counties. So it's not just the traditional. So if you don't know where to go, that is one point of call, and we have partnered with our partners to see what offers are available there. We also have recently partnered with our low-cost carrier Jet as well as Kenya Airways to see what are some of the synergies that we can bring to Kenyans to be able to enjoy the destination.
And something that is always advisable, apart from you holidaying during the holidays, perhaps we need to think beyond these structured holidays we have in the year and perhaps go on holiday in like January. Is this something that we are also, as an industry, ensure that we orchestrate to work in our favor?
Yes, I think one of the things that we do is help people understand a weekend is a holiday. Which means that if we make a strategy that says we will put together offers and packages that allow people to see if I have 2 days, if I have 3 days, if I have 1 week, these are all of the things that I can do in the destination. Then it helps people make that decision fairly quickly. And if we package it in such a way that we have a partnership going on between the government and the private sector, then and also airlines and other modes of transportation, the railway, the roads, it means that you can present to a potential traveler, a potential Kenyan, a very quick decision in terms of where they can use a little time that they have to experience the destination.
Okay, and even as we walk into this holiday season, I mean, we cannot ignore that there is concern with the new variant, you know, Omicron. So what are we putting in place to perhaps, you know, cultivate confidence within and without?
Luckily for us, our industry has been really diligent in terms of making sure that protocols were in place from the beginning. When we put together the Magical Kenya, travel protocols, and those protocols have remained in place. So I think it's to urge the travelers to adhere to those protocols, because when you go to different locations, you will see, especially in the tourism sector, that these protocols have been put in place, and the hotels and the tour operators and other people in the hospitality industry tend to really focus and ensure that their guests adhere to these protocols. So I think it's to urge Kenyans and other travelers that are moving around to really embrace the fact that you need to take charge of your own safety. Because the protocols are already in place. Yes.
And even as we bring this to a close, what is the expectation for the next year in regard to the rebound of the sector, and what is KTB planning to ensure a successful 2022?
We believe that we will rebound. So that's one positive aspect. But I think we need to move forward fairly conscious of the changing scenario in terms of the pandemic, and being quite quick in terms of figuring out what are the opportunities that are available. From the perspective of emerging markets, from the perspective of existing markets, and specifically from the actual marketing activities that we put in place. We must embrace technology. We must embrace other forms of engagement with consumers. We must move to where the consumer is in terms of how it is that they are searching for places they want to go. There's the sensitivity around safety and around health. So we must be right front and center in terms of presenting the destination's readiness in that aspect. And then over and above that, we must reach out to markets that seem to be a lot quicker off their feet in terms of availability to travel. I know there's the general view that people want to first venture to places that are in and around their locality, and then possibly regionally before they consider long-haul travel. But even in that aspect, we as a destination can begin to help people to dream about the destination by putting forward some of the interventions that we have in place. Conservation has become a huge area for people. They want to understand, even when I travel, I want to make travel meaningful. So what can I do in the destination? We say that go and visit the destination, but don't destroy the destination. Embrace the destination. Ensure that after you visit that destination is all the better for you having visited. The concept around conservation and sustainability is the opportunity for a symbiotic relationship between both travelers, communities, and tourism, where all three parties work together, especially for the benefit of the community, because the community is really the custodian of that offer that destination has.
And now, Betty, before I let you go, I've got to say 2022 is an election year.
Yes.
Is KTB concerned about this? Are we ready for it?
What we say is that we must message, and we will message really early on, that the election is a day. What we as a destination need to ensure is that we are sensitive, and especially the media are sensitive to the fact that the destination needs to continue, the country needs to continue even after the election. So in terms of messaging, in terms of reporting, I think we would like to appeal that the media are fairly sensitive because depending on how you report about that aspect, which is a calendar event that will happen within our destination, it has an impact on the destination even moving forward. So we as a community and as a country and as responsible citizens can make the choice that we will report on the elections, yes, but we will be cognizant of the fact that we have a destination to ensure that we have longevity even after the elections.
Well said. KTB CEO Dr. Betty Rodier, thank you for your time. And of course, even as we found out how we can best put in place to enjoy the holidays that are coming and of course sustain our tourism sector. Well, as I said, we'll be shifting gears in a moment, even as we look at how to care for carers, and we're focusing on healthcare workers. Stay with us.
Here at NMG, we are working very hard to ensure your favorite publications, Daily Nation, Business Daily, Taifa Leo and the East African are readily available. In a bid to support the efforts to prevent the transmission of COVID-19, NMG has ensured our staff, our distributors and their staff adhere to set guidelines. At our printing plant, all staff are required to wash their hands before entering the factory and must be wearing a mask. All workers either change their clothes on entering the factory or wear an overcoat. We are keeping doors open to avoid our staff touching door handles repeatedly. With our automated printing, contact with the newspaper is kept to a minimum, and at the packing process, the staff observe social distancing. Vehicles used to transport the newspapers are disinfected daily before the newspapers are loaded, and our delivery staff all wear masks and wash their hands regularly. Our vendors ensure that they sanitize every time they handle money and wear their masks at all times. NMG is proud to be able to safely meet your information needs. Stay safe, stay informed with our favorite NMG publications.
Accountability and ownership is not very clear.
NYS is a place where people go and steal money, and that money disappears. We never talk about it again.
A lot of theft has taken place after the handshake. ODM people, after the handshake, they see no evil, they hear no evil.
When things are not right, we question.
Financial data in Kenya is served cold.
Should President Uhuru Kenyatta be impeached?
Those are the list of our problems at the moment.
We should be embarrassed.
All
of us.
And hang on, what is the citizens' work?
The citizens' work is to demand a better economy.
Numbers are important. They give context, better understanding. Business news has to deal with lives, going beyond tough terminologies and numerous numbers. I, Nina Shaban, will take you there.
NTV News. Bold, balanced, authoritative.
TB ina tiba. Pata matibabu bila malipo katika hospitali zote za umma. Tujijali, tumalize TB. Ujumbe huu umeletwa kwako na Wizara ya Afya na washirika wake.
For an exclusive fragrance experience, try Nivea Men Deep Impact Body Lotion with a long-lasting woody fragrance, deep moisture, and a fresh skin feel. Make an impact with Nivea Men Deep Impact. Nivea Men, it starts with you.
Elena must never find out that you're not Lucas.
I know.
We need to keep her at bay. Act like you're a quiet person, someone who doesn't like talking about his painful past, and if you do have something to say, make sure it's nowhere near the truth.
Lucas? Come here, please. I want you to meet Oscar. He's one of our clients.
Nice to meet you.
Hello. Have we met?
Hello. Good morning.
Good morning.
At KMC, nyama sio nyama tu. You'll get our products at KMC Nyama Haven outlets in Athi River, Landhis Road, and soon coming to you, Mombasa. Nyama near KMC, a cut above the best.
Thank you for staying with Your World. My name is Gladys Gachanja, hoping you are doing well this Monday morning. Now, I mentioned we are now crossing over to another conversation this morning, and we are actually catering for the welfare and health of our healthcare workers. And we are literally calling these the caring for the carers, because that's who they are. But at times we think these guys are superhuman and they don't go through life like we do. But the truth of the matter is they are human first before they take on their profession. So that's why this morning we'd like to humanize them, understand their journey, understand how they experience life on a day-to-day, and perhaps what much more needs to be done to support them in their health and wellness. But before I get to introduce my panel, let's take a look at some of the stories making headlines this morning. And I'll start off with Ivory Coast, if we may. Changing the way society looks at disability is a challenge that some 20 disabled models in Abidjan, Ivory Coast, have taken up by stepping onto the podium. Now, Grace Beho, a 22-year-old student, is the organizer of the first edition of this project, having had her hand amputated following a road accident. And now Grace Beho campaigns for the empowerment of women with disabilities. And Grace actually says after this show, I think that these women who are going to watch us who don't have this self-confidence yet will really have this feeling of other women have done it, so why not me? They will assert themselves, and I think they will show themselves to the world as they are. It is a blessing for me to show myself to the world in a wheelchair. Words fail me. I am happy. I'm very proud of myself. First of all, because I am now able to show myself to the world. Back home and to a sad story. The Mwingi Junior Secondary School bus that plunged into River Nziu in Mwingi, Kitui County was finally retrieved by officers from the National Youth Service Sunday. This comes nearly 30 hours after the accident occurred when the 51-capacity bus ferrying about 70 passengers was swept away by the raging waters. Ruth Sarmue has more. All right, so at this point, I think we need to also keep in mind that earlier on in the year, the Kenya Medical Association actually called on the government to better cater for the welfare of healthcare workers, especially in the pandemic. They not only called for the provision of COVID-19 vaccines for all cadres of healthcare workers, but also psychosocial support. So now that we're talking about healthcare workers, I've got some who are with me in studio and others joining us virtually. I'll start off with Dr. Eubrin Moroy, who is a consultant physician and a health advocate. We are also joined by Eunice Ngare, who is a midwife. Joining us virtually is Dr. Lukoye Atwoli, who is a professor of psychiatry and the dean at the Medical College East Africa of the Aga Khan University. And of course, Mercy Minor, who is also a nurse, joining us all the way from Meru County. Thank you all for being part of this conversation. And our question of the day to you, because we'd like you to be part of this because you experience them on a daily when need be. Which healthcare worker, doctor, nurse, pathologist, psychologist, etc., you know that list is long, would you like to appreciate today and why? Which healthcare worker would you like to appreciate and why? That hashtag is new normal, and I'm told some of you is already talking to us. We have Daniel Airokundungu, who says a nurse, she carries all assignments by the rest, but she ends up getting lowest pay. Her fees doesn't even appear in the bill. That's a lot of sacrifice. Bravo to all the nurses. Daniel, asante sana. Another here from Eubrin, I guess. I celebrate and appreciate all health workers for the sacrifices we make every day, and especially during the pandemic. All our dedication, commitment and courage deserve the deepest gratitude and admiration. Our service to our patients is to serve countless lives and support the entire health system in a different capacity, making thousands of differences. All healthcare workers are special heroes. That is true. Winnie says there is no health without mental health. I do appreciate all the mental health workers for their tireless efforts in the health department. Hashtag psychologists forever. Thank you, Winnie. Another here from Catherine, who says, I do appreciate all health experts for their excellent teamwork and long working hours. God bless them and much appreciation to you. Thank you, Catherine. And the last one, for now, Nema says, healthcare is multidisciplinary. No one can work as an independent. Very well said. And we encourage you to keep writing to us. That hashtag is new normal. And you can also call us using those numbers at the bottom of the screen as we continue with this broadcast. And I'd like to start off with you, Bryn. You've already put across how you feel about celebrating these healthcare workers, those that we actually consider superheroes amongst us. But when you think about the care for the carers, what does that mean to you, considering you walk in these shoes on a daily?
Basically, I think it's sort of a moment for us to reflect and just say, if you're going to have another human being serve you, ensure that they're taking care of you at your most vulnerable moment, then who does take care of the person who takes care of you? Because just the same way every human being has a moment when the cup is empty, the cup does not have any more to give, then these health workers, because they are human too, they do get to that point where they have nothing more to offer. And this is because of the humanity that and our own mortality that we appreciate. So I think it's a nice paused message to just highlight the plight of the health worker while providing care and trying to keep their head up, particularly which mostly, like has been really well demonstrated during this pandemic. Who is giving you the care that you're giving to other Kenyans? Yes.
Well said. Now, for you, Eunice, you deal with these little babies that come into the world on the daily, and of course, they're being brought forth by these mothers that have literally put their lives on your hands. What does that mean to you, now caring for you within your line of duty?
Well, thank you for having us here to discuss this. First of all, the topic was exciting to me.
Yeah.
Because, first of all, I say God has really been gracious to health workers in general. Because we can say that it is the employer or anyone who has protected us. We really thank God, because the situations we've undergone, it's not easy. So I say, I look at the vulnerability which we see with the little ones when they are being born, and even the mothers, because we undergo through maybe the emergencies. You see the mother is vulnerable and the baby is vulnerable. So some of those situations, if in many times they are not addressed, and that's why we get like a lot of burnout. Something which happened many years ago, you keep remembering, I lost that mother, but I did my best. So some of these things are so emotional, and that's why it's good to talk about them, and you know, critically to come with a conversation with an employer. What is it that we need to do for the health workers in general?
I hear you. Okay, now let's talk to Mercy. Mercy is literally very young in this sector. She is 1 year in a few months, meaning she was thrust into the sector amidst the pandemic. How has this experience been for you so far? Mercy, can you hear us?
Can you hear me?
Yes, we can.
So thank you for having me here. And for me, when I began, it was very tough for me. But so far, I have come up with ways to keep me going, through coping mechanisms rather. And I would actually say it was very, very tough in the beginning, because you get to experience people in pain, people dying, and all these things. And especially because you're human as well, you'll also feel bad for having all those things. But every single time, reminding yourself that you've done your best, and is everything. And for me, my reason for coming to this career was the fact that I wanted to have a positive impact. And so anytime where I don't see it come to fulfillment, it will really drain me.
Yeah. We hear you, and we'll talk more about how you've been able to cope and perhaps some of those experiences that have been daunting for you. Professor Lukoye, you've been in the sector for a while now, and as we heard from one of the feedback, there is no health without mental health. This is your forte. So when we talk about caring for the carers, what does that mean to you?
Thank you very much, and thank you for having me.
Okay, we seem to have lost his picture, but we shall sort that out in a moment. But Yubreen, the mental health aspect, I think, is what has really been thrust in the limelight, especially within the pandemic, because somehow the pressures of a job have been exacerbated. Walk us through what this pandemic has been to you.
Maybe let's just go back to where you've had the young nurse Mercy talking about why we get into this job and why we choose the careers we choose. Normally, for most health workers, it's a calling. It is there's something that sort of really touched you that you got into this career. The career, even before the pandemic, there were already people going through mental anguish, mental health issues, right from depression to anxiety to post-traumatic stress disorders to excess worry, and other people actually just going into bipolar and the other spectrum of mental disorders. So before the pandemic, the mental anguish was already there, and it was not addressed. And then we go through a pandemic that we've all heard about, how a lot of highlights have been put around how this pandemic has affected every Kenyan, just including the health worker who already was more predisposed through getting into mental health illnesses. So if we look at this, it's like an additive, sort of a cumulative effect that has happened, that eventually now you're having to go through seeing your patients die, and you basically can't do nothing because you have done everything within your power. You're seeing hospitals fill up. You see that there's a patient who needs a bed for an ICU, and if they don't get that bed, they will die, but there's another one who's on the ventilator that you can't pull out. So that sense of helplessness, the sense of worry and stigma in society, where as a health worker, if my neighbors will stigmatize me because I'm a health worker, and maybe even some friends thinking that maybe I might be the one who's spreading the virus, your children being stigmatized. So there's the family angle. There is the social angle where you can't really interact with people much. And there's just the pressure of the job, lack of infrastructure, equipment, and correct setup for health workers to work in the different areas. All this compounded together, plus the pre-existing risks already, is such an immense and tremendous burden on the health worker. Yes.
And how have you found your footing? Because at least we are 1 year in, 1.5 years in, going into 2 years.
It's not been easy. You have moments. You just you have moments. I've had moments when I've lost it. I've had to sit down and cry like a normal person, you know. And this is the thing that you're earlier on highlighting, that people think we are superhuman. We are not superhuman. We are just like every other ordinary person who cries, who laughs. So there are moments that you feel really overwhelmed. But what has really worked for me is my social support system. I have people around me and my family that is very supportive, and I have someone I can talk to. So that really helps. But not to mention that it doesn't mean that I don't get overwhelmed. I do get overwhelmed. I do feel helpless. I worry a lot. I realize even my own level of anxiety and irritability was a bit higher during this pandemic. It had to be pointed out sometimes, right from my partner to my children. They're like, "Mom, you're a bit, there's something wrong here. You know, why are you shouting? You know?" So you cross a line, and you know, if you're not self-aware, and most of us are not, then you find yourself tipping over, either into substance abuse or any other things. And the rates of suicide, not to mention that they are higher, but the healthcare workers, the risk is a bit higher considering all these other mental health issues.
Very well put. And I think we have Dr. Lukoye back. Just listening to Dr. Mora, you resonate with this because it has been a reality for many healthcare workers within the pandemic, right?
As I was saying earlier, I think it's important for us to acknowledge that we have set aside a certain group of humans to take care of the rest of us. And therefore, we put a huge burden on their shoulders to take care of us in our times of need. And we must therefore ensure that they are at their best when they are taking care of us. Unfortunately, that's not what we always do. We assume they're superhuman, that they can take care of themselves, and we don't need to worry about it. So what I'm saying, therefore, is that as we think about the health of our health workers, I think, especially the mental health of our health workers, we shouldn't assume that it is the responsibility of health workers to advocate for their own mental health. It should be the responsibility of the citizens to say, we want our health workers to be at their best when they come to take care of us. And therefore, there has to be a system in place that ensures that they are well taken care of. We did a study at the beginning of the COVID-19 pandemic last year, between March and July, to look at the mental health of health workers at that time, before the effects of the pandemic. And we found that already at that time, many health workers already had high levels of depression. Many health workers already displayed symptoms that are clinically significant of anxiety. Many had symptoms of post-traumatic stress disorder, some of the things that my colleagues here have been talking about. And many of them had problems with substance use. And this was at the beginning of the pandemic. And we thought that based on how the pandemic was affecting the citizenry, and therefore double burden on the health workers, that we would expect that these rates would increase during the pandemic. And therefore, it was necessary for hospitals and any institutions that employ health workers to think very quickly about how to ensure that their health workers are well taken care of during the pandemic. Some of the things that we would expect is that health workers would have an opportunity to regularly debrief, to regularly discuss how the care that they're giving makes them feel and how it is affecting their lives. Some of the things that Ubrin has been talking about. They need an opportunity to share, and they need an opportunity to share how they are coping, because majority are coping and they have very good coping mechanisms, and they can share with their colleagues to ensure that their colleagues also take on those best practices. So then secondly, obviously, all healthcare workplaces must have access to mental health services, so that if a health worker says, today I'm not feeling up to it, today I'm feeling down, I'm not okay, then they can be referred to a professional who would listen to them and take care of their needs so that they come back to the workplace as their best selves. So these are some of the things that we have to worry about. And as a citizen, I would worry if the health worker who's coming to take care of me is not in the best state of mental health.
We hear you, Professor. Now, Eunice, I think we just need to paint or shed light on how a day-to-day looks for the healthcare worker. In your scenario, you're a midwife. You walk into Pumwani Hospital today. How does your day look like?
Well, first of all, the most important thing for any health worker is to have a psychological preparedness. When you are psychologically prepared, in a situation like Pumwani, where we have so many mothers delivery at the same time, or any other place where there is a lot of influx of patients like Mama Lucy. Basically when I talk of Nairobi, you know, the crowded, how our hospitals are crowded. Apart from mentioning the private facilities, but even the private facilities, sometimes the waiting time also takes some time. You have to be prepared psychologically. And then you do a bit of planning. And the challenge will come when I want to plan to do ABCD, and you find some of the equipments, the non-farm, they are not there. So your stresses will begin from there. I am psychologically prepared, but I don't have ABCD. So yeah, at that point, I would wish our employer or within the facility to make sure that the things I need to work with are available at that time. And then the other thing you find in a place where the the mothers come crowded and all that, you find we are few. In that situation, you find when we are few and you are expected to to deal with a large number of patients, of mothers, it's really a challenge. And that's why I'm saying, if you look at our healthcare system, basically, for example, if I say like NMS is trying to open so many healthcare facilities, but are the resources, the human resources there? You get, it's still a challenge, because if you open this place and you dysfunction this other facility, then you are not doing good to the citizens. Because if anyone comes to a facility, expect, you know, to good services to go on. But for me, a life of a midwife is a real challenge, especially when you're dealing with large number of patients. But in that case, I'll try to prioritize who needs to be seen first. And then because of that large number of patients, you find even when you prioritize, because of the you know, the many patients there, you find also there will be a problem, for example, in theater. Theater is also a lineup, who to be taken first. And that's most of the challenges which I find it needs to be looked at critically.
And I'm just wondering, so a day has gone, you've dealt with so many women, some you felt you couldn't do much because you didn't have what it takes to help them. How do you debrief at the end of the day?
Well, it is also a challenge because, first of all, it is for me, I need a professional to do that. Or we arrange, in our setup, we arrange one person to give the information, not everyone. Because you find many patients are brought by different relatives. Something has gone wrong. One should not give an information, the other person is giving the same information differently. We need to have a setup where an information is given to this client like one person, and that's why I'm saying we need like a professional. We need counselors in our setup, not only to counsel the mothers who have maybe lost or the relatives, also to counsel the healthcare workers, because we don't have that in our setup.
I hear you. I hear you, Eunice. Well, remember, we are also asking you, even as we appreciate these healthcare workers amongst us, who would you like to appreciate this morning? Remember that hashtag is the new normal. Before we hear from Mercy, let's take some of your feedback. Remember, which healthcare worker would you like to appreciate this morning? Ann Kwete says, I appreciate all healthcare workers. They are a team and work together for the benefit of the patients. Asante sana, Ann. Gideon Sonko Jr. says, I appreciate all health experts. We serve the same purpose to the patients. Asante sana, Gideon. Another from Romeo, who says all nurses should be appreciated in a unique way. They are the first people you meet when you get to the facilities and all through till you are discharged. Asante, Romeo. Peterson says all biomedical engineers who are always there for the success of all healthcare departments feel appreciated. Asante, Peterson. Another here from Makumbi, who says nursing patients calls for love and divided attention, devotion and commitment. Well, at this point, let me take a quick break. When we return, I'll hear from Mercy. She had already mentioned that she is having a hard time, or she had a hard time starting off, but my director tells me I have a bit more time. Okay then, so let's hear from Mercy. Mercy, you mentioned that starting off it was so difficult dealing with the losses, dealing with watching people go through pain. How did you get to a point where now you're able to cope with the same?
So in the beginning, I think the places where I had rotated when I was a student, I had not experienced so much loss. But when I was sent to a referral center where you get the patients who are there actually very sick, very, very sick. So you're going to expect a slightly higher amount of loss than the rest of the places. But one of the reasons I've been able to get better is because I've found ways to be able to cope with that. For example, when there is something like a loss in the hospital, I will get someone and I would talk to them. And if I don't get that, I would get home and I would write down what happened, how it made me feel. Is there anything that I would change? Things like that.
When you say you talk to someone, what do you mean? Who? Your colleagues?
Colleague. Yes, someone who we were in the same shift together and we experienced the same thing. Yes.
Okay. And how has that worked for you now?
It has worked. It has worked very, very well for me. And at the same time, also getting something fun to do outside work so that it can help you switch from what has happened. So for example, I enjoy watching movies. So when I get home, I'm going to do something that I love doing, something that will make me get over what happened during the day. Yes.
I see. Now, earlier when we were speaking, you had said you've also gotten this ability to switch work from personal life. How do you do that?
So I make sure that I leave everything in hospital. So if I'm going to talk about it, if I'm going to write the journal, I'm going to do it while in hospital. So once I'm out, I'm out.
So when your shift is done, the end.
Yes, the end. So I sort of let go of everything that has happened during that day. So if I'm going to talk to someone, I'll do it while I'm still in hospital. If I'm going to write it down, if I'm going to cry or anything, I'll do it there. And then once I'm done,
All right. And how has that translated now to this balance you're trying to achieve?
It has worked better. The previous time I used to get home and I'd really think about it. So, which was not healthy because, yes, which was not healthy at all.
I hear you.
Because, yeah.
Now, I see you, Breen and Eunice, laughing at, of course, Dr. Lukoye, but I know this profession, you are always a doctor all the time.
Exactly.
How do you strike the balance, Maura?
That's a tough one. I think for Mercy, it's a bit easier. She's a nurse. So when she leaves the hospital, she goes home. But for the doctor, even when you go home, you're still called. Back to the hospital, patients will still call you. So really, there's normally no clear, very clear demarcation about work and home. And she brings forth a very important conversation we need to have for how do health workers have a work and life synergy. I don't think it's a balance because you can't choose one or the other. So it's a synergy. How do you how do you mingle them up and blend them such that you still have a life and still do your job? And you know, let me tell you a very interesting example. So as a doctor, I will take time out from my work. Like maybe I've taken a few days off, but my patients still call me. And you know what? They expect me to pick up and address their problem. And you know, it's only natural because these patients have really entrusted you with something very important to them, which is their health. So they still want to call you at 2 a.m., at 5 a.m., and they expect you to pick up. And remember, I have a family, right?
Yes.
So how does it balance that? Maybe I was spending time with my spouse or with my children, but now I have to pick this call, and they have to understand that, you know what, mom has to pick this because she's a doctor. But now the thing I think that our prof was even mentioning earlier is that slowly by slowly these things get to you. You don't realize. I just respond because it's my duty. My first duty when I chose this career is to do no harm. So if I don't pick that call and someone gets into a lot of trouble on the other end, then I'm not fulfilling my duty. But how do I make sure that I still live a human life while serving the people I chose to serve?
That is a good question. Professor Lukoye, help us out here.
Yeah. I think I have heard Eunice and Mercy and Ubrin discuss things that are very, very important at this point. And I want to point out something called moral injury, which I think Eunice brought out very well. And moral injury is about you being prepared to do the right thing, to save lives, to save limbs, to make sure people are healthy. And then when you get to the point where you're supposed to offer the service, you don't find that you have sufficient resources to do so. And so you end up watching people die, watching people suffer, and this injures you and you go away asking yourself the questions that Mercy is talking about. Could I have done anything to save this life? Is there a way I could have done this better, and so on? And that injures you. And moral injury is just as bad as physical injury. It leaves scars, and it makes you less effective at work. The other thing is burnout. So with burnout, you might have everything you need to do, to care for the patients you have. But then you get overwhelmed because of the need. And at some point, you are so empty, you have nothing left to give. And this is what we would call burnout. And many of the health workers that you interact with experience burnout because of shortages, because they're few, because there's a huge burden of disease. And then you have scenarios where we assume health workers are superhuman, and that during their training they're trained to be immune to the feelings that the rest of humanity have, especially around death and suffering. But they don't. Every death affects the health worker just as much as it affects the relatives of the person who has died. And so some of them will experience, and you've had experiences of somebody going home and getting flashbacks about some event that happened while at work, or not being able to sleep, or constantly ruminating and thinking about things that have happened at work. And this might be some of the symptoms at the beginning of either acute stress disorder or post-traumatic stress disorder that many health workers struggle with. So these are the realities of being a health worker in Kenya. And it's the same way when we send soldiers to the front line to go and fight to protect us. We have a backup behind them of health services and mental health services, so that we ensure that when you put a gun in the hand of a soldier and send him to go and fight to protect you, that if he suffers any injury, he can run back and get health care that he needs or she needs. Same with the health workers. Same with the health workers. So we have to put in place mechanisms to ensure that they can get support when they need it. I liked what Mercy said. Mercy is already self-helping, journaling, taking time off, going home and saying, listen, that was work, now I'm home, finding fun activities to take care of herself. So those are some of the things that we encourage health workers to do in order to remain healthy when they come to the workplace.
But there's something that you put forth. I mean, you cannot not pick up this call. So what happens? How do you draw the line?
Yeah. So I think it's a fine line. At the end of the day, in an ideal situation, when the doctor leaves the workplace, he or she will leave a colleague at the workplace taking care of issues, while he or she goes home to refresh and to take care of themselves in an ideal situation. So when a patient needs help, they would call the hospital and they would get connected to a colleague who is on call or who is taking care of business while the others are away. We don't live in an ideal situation. And so the situation you describes is not an ideal situation. Patients know that there are very few doctors, and when they connect with you, they feel you are going to sort out most of their problems, no matter what time it is. So they will call you at home, they will call you when you're on holiday, they will call you when you're on leave, and it is difficult to strike that balance. So what I would advise my colleagues is when you absolutely cannot pick the call, don't. Because it is better for, because if you pick the phone when you're not okay, you probably have a chance of doing more harm to the person who's calling than if you didn't pick it and the person got help from a colleague somewhere else. The second option would be to, if you picked it up, to link them to somebody who is on duty or somebody who's on call or somebody who's working, so that they can then speak to that person while you take your time off. The worst option, obviously, is to interrupt your holiday, your sleep, your leave, and pick the phone and spend an hour on the phone solving a problem that should be solved by somebody who is already on duty or on call. So health workers are humans too. Doctors are humans too. They sleep, they go on holiday, they need rest, they have relationships, And some of the relationships they have are hurt by the work that they do, because some of those calls interrupt activities that other humans wouldn't be interrupted when they're doing. But doctors have to, often get interrupted in doing those things. So it is important for us as citizens and as people who seek health services to appreciate that the people who are giving us these services are also human. They get hurt, they get tired, and they get hungry and so on. And so forth.
Well said, Professor Lukoye. Well, at this point, we'll take a quick break. But when we come back, as much as we all need to be cognizant that healthcare workers are human beings, these healthcare workers, from what I hear, also need to be self-aware to keep their head above water. We'll talk about that in a moment. Stay with us.
Upgrade today and save 50%. Pay 2 months and get 2 months of a higher bouquet. Star Times, your best choice for family entertainment this Christmas.
Who is a true partner? Partners let you start afresh when you want to leave the past behind. A partner is someone willing to go beyond the call of duty. They go out of their way to help you. Partners work behind the scenes to make things happen. They do not hesitate to go the extra mile. They are with you as you make your next move. They open up new possibilities, and they're always there standing beside you. They step in when you need them the most. Because a true partner is a partner kwa ground. KCB Bank, go ahead.
I'm excited to continue on building, but I believe we have to keep the dream alive.
How great was that? How about that block by Beasley? Wolves still come up with the basketball, and Edwards finds it for the stuff. Throws it down.
Behind the back to Harris for the jam.
Throws it and slams. Get that shot out of here.
Nini ya kusumbua?
Nikwambia niko sawa.
Niko sawa? Mbona unafikiria kwa huzuni hivi?
Just look at her. She's too perfect. Hakuna mwanamke katika hii dunia ako perfect hivyo without an ulterior motive. Trust me.
Unahitaji chochote?
Pieces of Us in association with Nivea Nourishing Cocoa Body Lotion.
It's time to show off your best skin. Wear your skin with pride every time with Nivea Nourishing Cocoa Body Lotion.
Numbers are important. They give context, better understanding. Business news has to deal with lives, going beyond tough terminologies and numerous numbers. I, Nina Shaban, will take you there.
NTV News. Bold, balanced, authoritative.
It's super cool to be a mass superhero, to get the spread of the virus to 0. Did you know that anyone who is 6 years and older can be a superhero and wear a mask? That's right, they can. If you're 5 years old and under, don't worry. You can be a superhero too by reminding your siblings and family members to wear their masks too. Wearing a mask helps protect you and others from spreading viruses. To get the spread of the virus to 0.
During his time at PSG, Neymar has missed more than 100 games through injury and suspensions, more so through injury. While Juventus has advanced to the last 16 of the Champions League, it is 7th on the Serie A table with just 7 wins from 15 games. Diogo Jota has emerged as a player of importance for Liverpool and has clearly earned a rave review. All the news and analysis of European football on The Football Review.
Wow, thank you for your time. How juicy.
Juicy.
Juicy fruit, juicy, juicy fruit.
At KMC, nyama sio nyama tu. You'll get our products at KMC Nyama Haven outlets in Athi River, Land His Road, and soon coming to you, Mombasa. Nyama near KMC, a cut above the best.
Thank you for staying with Your World. My name is Gladys Gashanja. We are having a conversation about how to care for the carers. In perspective here, healthcare workers. And still in studio, Dr. Mora, we still have Eunice, Professor Lukoya joining us virtually, and of course, we have Mercy Wizanas joining us all the way from Meru County. Thank you all for being part of this conversation. So I see you're also talking to us even as we ask you to appreciate these healthcare workers, because at the end of the day, they come through for us, but we cannot forget that they are human. And that's why today we are taking time to humanize them, so you understand that they experience life just like you do, just with a bit more pressure on them. So that hashtag is new normal. Whom would you like to appreciate this morning? If we can have that feedback on the screen. Do we have any at this point? Okay. So Shirley Wanyama says, gynecologists, those people help bring forth life. Shirley, thank you. We have Lawrence who says they all coordinate for the well-being of patients. My vote goes to pathologists, though. They make diagnosis, which forms basis for the treatment of someone. Lawrence Asante. Edith Gitahi says, I'm a sonographer and appreciate the whole radiology department countrywide. We are the eye of medicine. Edith Asante. And a last one here from Jeanette, who says, all healthcare workers and nurse can't work without a doctor, nor a pathologist, nor a psychologist. We all need one another. Very well said, Jeanette. Remember that hashtag is new normal. And if you'd like to be part and parcel of this conversation on call, remember those numbers at the bottom of your screen is how you can be able to reach us. Now, some of you are actually saying we need to actually address toxic work environments. We all have a story to tell in our different industries. How does that translate to, especially in the healthcare profession, Eunice?
Well, for me, if I may talk a little bit about nurses, it's like day-to-day life. Because for one, you find, especially the young nurses, the young nurses, you find that goes with the you know, the seniority and all that. You find the young nurses, especially in this era where we have the contract nurses, the most toxic things I've found is like when they are not paying the same, they are discriminated in terms of remuneration. And this is a kid who has undergone some sort of a stress training, maybe they have taken a loan or something. And then you find they have paid around, let's say 500,000 Kenya shillings is a loan. And where you get to work, you are not paid like the others. And this person is expected to deliver. And you know, you are not being paid together with, you know, work of equal value should be remunerated the same. But it doesn't happen, especially in our government setups. So you find there's a lot of, like you are given a lot, you know, those are the young girls, the young, you know, men are the ones we put in like frontline where we have like a lot of deliveries. A place like where I work, we have 40 to 60 deliveries in a day. You close your eyes, a child is being born, do you expect quality? You know, when you get at the end of the day, you get so worked up, and then somebody somewhere, like a boss, comes and backs at you. Why did it happen? Why? What did you do? You know, that kind of an environment. We find it's really bringing psychological trauma to the young nurses, and that those are some of the things we should be identified and, you know, being taught at the management level, so that, you know, these are the young people who are going to be our nurses for tomorrow when we grow old. And so you expect them to have a, you know, good sort of mindset so that they are able to deliver at that moment.
Yeah.
But you find the situation is different. You find there's a lot of bullying, there's a lot of, you know, discrimination, as I've said. Yeah. And not only that, you find like when you have all this stress, you at the end of the month you don't get the right timely payment, and you know you have, for example, you get sick. Like there's a scenario where this period of COVID, there are even nurses. We have over 50 nurses in this country who have died for COVID, and others. Those are not now the sick ones for COVID. Those are the known ones. We have others. It's so traumatizing, especially when we have a nurse. Doctor talked about discrimination. Even when you have this point where when COVID came, we have nurses who are working in the setups which were set all over the place to you know, to take care of the COVID. The COVID setup came in Tunisia and all that, the hotels. You know, these were not the right setup for the healthcare workers. You find they are contacting COVID when they are working. These are nurses who are coming from their place of work. These are nurses who used to call me, you know, I'm one of the leaders in the union in this country. So they called me, what are we going to do? Do we run away from the place of work because this place is terrible? They contact COVID when they are working, and then there was no, you know, good measures to take care of them when they get sick. So I remember one of the nurses I was discussing with her yesterday. She told me, in fact, I had to run away from the hospital, but he was caught at the gate. She was running away because this place she went to this Bagadi place, but she had a lot of, I thank our director, maybe through the, you know, that system where we said now the COVID healthcare workers can go to a place like KU. You know, but to coming to that far, we as the union leaders, we had to fight. So up to which extent do we really need to fight over these things? Give us timely money when we, you know, like remuneration. Those counseling and services, let them be in place where I have a psychological, you know, state of mind, good state of mind, so that I'm able to deliver. So some of these things, when you get sick, this nurse has left kids. The kids, no one wants to take care of the kids. And at this time, we used to have ambulances going to her place for maybe the injection. They are going for the jump injection. So the neighbors would not even want to talk to her because she's a healthcare worker and she has COVID. Who will take care of the kids? The kids took care of themselves. So this kind of trauma is so much, and that's why we are advocating for psychosocial groups within our setup, so that we are able to identify those things and talk out those problems and how they can be identified.
I hear you, Eunice, and definitely there are other aspects that are also trigger points. For example, I understand most healthcare workers are normally either working, going to school at the same time, and for those that have families, of course, have that responsibilities. Others have more than one job. Yubrin, did you ever experience this when you were younger? And the stress points, because I've had some say this is one season that most of them choose to give up.
That's sort of the gospel of the medical training, whereby after we do our undergraduate, you obviously have to go specialize for most people who choose to specialize. And as the advent of devolution of healthcare, less people were getting sponsored by government, so they had to take themselves back to school to specialize and sponsor themselves back to school. And the agreement with most of the county governments was you basically quit because you can't go to school. We don't have money to pay for your specialization. Basically saying we want just a general practitioner, we don't want a specialist. So people leave employment and they have to go back to specialize. And there are two big centers now, the University of Nairobi at KNH and Moi Teaching and Referral Hospital in Eldoret. And when you go back for training, you have no job. And trust you me, we don't go back for training when we are 19. We've already done our undergraduate. By the time you finish your undergraduate, you're either between 25 and 28 if you delay it a bit. Okay? So if you're leaving at 28 or 25, most likely by the time you choose to go back to school, which is about 2-3 years after your undergraduate, you already have a family. What will your family eat? So you have to find ways to say, I'm going to sacrifice and go back to school while I still have to work to support my family while I do my specialization. That's the true scenario for up to 60% of the residents of this country. So, go back to the demographics. About today we discuss who takes care of the carer. The residents in these two major top-tier referral hospitals are the ones that provide the most care. But they do it, they are not paid. You know, you just come to school, you do school, this is the arrangement, you have to do this number of hours here, you do these clinics, you do this work, you do this ward rounds. And then when they leave that place, they have to go and do a job that pays them so that they can take care of their families. So during the day you're in KNH or MTRH, at night you're in a hospital doing locum because you know what? You have to provide for your family.
Wow.
So when do you sleep?
Wow.
You don't sleep. You take 2 hours or 3 hours of very quick sleep and you have to go to the next spot, the next duty area where you're supposed to do your stuff. And the demographics have shown us that most studies have even, Professor talked about them and said some studies were done even prior to COVID. Up to 60% of health workers suffer one form of mental discomfort, let me call it that way. And up to a third actually have depression. They at some point have depression. But the biggest number of these guys, or this demographic and cohort of people who have mental health, are residents. So it's younger people in training. They are doing their training then, their specialization training, or it's nurses doing some additional training. So you're training yourself for the betterment of healthcare for this family. In the process, you're risking your mental health, your family wellness, which is your psychological well-being, and your social well-being. And we say, what is health? Health is the amount of well-being that you have, the physical, psychological, and social and spiritual. So you have no time for church anyway, because you know what? You have to be in the next spot to do what you're supposed to do. And unfortunately, most of these guys who are in the demographics, the studies that have been done, is the young residents mostly tends to be female. So the female health workers who are younger suffer the most mental health issues that their male counterparts. But this is just to mention that most of the time this female maybe will be a married, because as you see, You get out of med school, you have to go for specialization. There's no time to catch up with your social life.
Yes. Oh, wow. Yeah. Okay, now we are understanding the intricacies of this, and when they say it is actually a calling, now we see why. Only if you actually make to stay in this profession. Now, Eunice, Mercy, you have decided that you're going to find a synergy, as Yubrin was saying. When you're working, you're working. When you're at home, you're at home. But there'll come a time, perhaps, especially if you want to specialize, where you might have to deal with what Yubrin is talking about. Are you prepared for this?
I'm not sure. I'm not sure.
Okay, where do you see yourself?
Thinking about it now, I think it's going to be a bit tougher, and I might actually have to find better, or rather, better help, rather. Especially because when you have to deal with family, you need to read, and you also need to go to work. That's a lot to take in, honestly. That's a lot.
Okay, now tell me this. At least now you're still single, you have your time, you can cut out when work time is, your time is. With what Yubrin just described, are you going to prioritize having a family?
Yes, I think that my social life is as important as my career. But at the same time, I just hope, I think when you get support, unless you get, I think when you have support from the people in your family, or rather the people who are outside your work, the people who are close to you, it's going to be easier. Unlike if you don't get enough support from home, and you're expected to also be very okay, to be able to get that balance, it will be much harder. So I think support
is important.
Support would really help make it easier.
Okay, we hear you. Professor Lukoya, you've been at this for a while. How did you get the synergy going here?
So this is a common question, and in the past people have asked about how do you balance your work and your life and so on and so forth. The true answer is that I'm not sure that I have found that balance myself, and I don't know that most health workers have found that balance themselves, especially in the setting of this country, where there is still scarcity of health workers, where there is still an excess burden of disease that is unaddressed. But we can only try. So at the end of the day, one has to be very intentional about making sure that they're healthy themselves. So I am very intentional about that, in the sense that when I go to work, I try to bring my 100% self to work. And I will do everything necessary to make sure that I do a good job. But when I leave and I'm no longer at work, then I try to bring my 100% to family. I try to bring my 100% to taking care of myself. When I need to rest, then I will rest. When I need to, socialize and go and hang out with my people and so on, I will do that, because that is part of taking care of myself. So that is important. And I just wanted to recall a little bit about the issue of the toxic work environment that was mentioned earlier. And the toxicity of the healthcare work environment comes from probably three sources. One source obviously has been talked about quite a lot, and that would be the employer, who puts you in a situation where you might not have sufficient tools to get the work done. And that makes the work environment extremely toxic for you, because you know what needs to be done, but you don't have the tools necessary to do it. Secondly, you can have a toxic work environment from colleagues, because even within the healthcare environment, there are toxic colleagues. There are people who are very negative. There are people who do not see anything positive in what somebody does, and they can make the work environment very difficult for you. And the third, and perhaps very important source of toxicity in the workplace, are the clients that health workers take care of. We have seen incidences where people, for one reason or another, decide to go and beat up a nurse because a patient had a bad outcome, and they blame that nurse or the doctor and so on. So they bring toxicity to the work environment. And a violent work environment like that demoralizes and demotivates the health workers, and it makes them feel uncared for. And when they are feeling like that, they cannot bring their 100% to the workplace. So we need to protect them from clients like those who come in with extremely high expectations, and you know, the workplace, they feel like it is not providing the care that they wanted, not understanding that the provision of the service, what they're seeing at the front, is a product of a whole chain of events in the background that resulted in the care that they get. So, you know, sometimes it's the insurance who have said, you know, we are not going to pay for that. And so the person you're sitting in front of has the misfortune of having to give you this information. And then, you know, you just, you know, lash out at them. And they're human. They will break. So we have to take care of them as well. So I think there's a multiplicity of factors that affect these health workers, that those of us who employ health workers or take care of health workers have to think beyond the immediate problems that we are seeing with the health worker and go back. Do they have a social life? Do they have friends? Do they have people they talk to when they're in trouble? Do they have access to mental health services, and so on and so forth? Before we start thinking about what is it that we are seeing at the front that is not working, or that is not working as we would like to work.
Okay, now even as we bring this conversation to a close, it's one that can go on for hours because there's a lot to be talked about. But I am hearing Professor also emphasizing on self-awareness. He's done that to keep himself going throughout the years. I'll start off with you, Eunice, briefly. How have you, or what would you advise others that perhaps are walking in your shoes to ensure that they keep their heads above water?
Thank you. Thank you so much. I'll say we have a responsibility of the community itself. For example, if a community around where you are working, they need to have a knowledge that the people working in the hospitals are their brothers, their sisters, and you know, their colleagues, and you know. And then also responsibility of the health workers. You know, when we go to the place of work, we should give 100%, as Dr. says. We give 100%, and also ensure that we have, if there is a knowledge gap, we need to have the employer now help us with the short courses and trainings, which will ensure, will make sure we get a perfect, like something like a coordination, so that we have a good service delivery. This one comes with a lot of budgeting, you know, for smooth running of the service delivery, and also like the things which harm us so much in our healthcare setting is things like coordination when it comes to referral system, that coordination, and also coordination within the private sector and the public sector. There's a bit of discord. We need to bring that coordination in our setup. For me, I think I've worked for quite some time in a healthcare setup, and I'm one of the people who work in this place and also gone to this place to make sure that I bridge, I live a life. But in this case, we need an employer who will give us timely pay, and also like career progression. Like in this case, where we have an employer who doesn't want to promote nurses, doctors, you know, promotion. You find like you have worked for like even 10 years with no promotion. You find then I need to go out of the country to get nice pay, and that's why there's an influx of healthcare workers going out, especially nurses.
Yeah. Okay, we hear you, Maura.
Yeah, this conversation has really gotten me. I think I'm feeling the pain for most of my colleagues. And maybe what I'll add is to just say that I think as a country, we need to think deeply and have this conversation openly about how to motivate our health workers and to promote resilience. And this will start right from ensuring that we create the right work environment, and also to educate our colleagues and people in the health sector that it is important to be self-aware, as you mentioned. And you first start by being your own keeper, and then we have to be each other's keeper. The one advice I'll give them, and maybe having gone through the whole process of doing many jobs and doing all those things, to my colleagues who are watching, is to mention that this wheel is never perfect. And the word we were using is, it is a work-life synergy. How do we make sure that we still work and offer the best to our patients, despite the fact that these patients normally come to us to bring their burden and cast them on us, but still most of the time blame us for anything that goes wrong, without understanding that we are human. Human beings make mistakes. Sometimes they don't, but it's nice to engage and understand. All that put into consideration, we have to make sure that the wheel of this thing we call life keeps on moving. It will never be circular, but it can be spherical so that it keeps on rotating and we keep on living, remembering that besides the careers we chose, we have a life to live.
You're human beings first. Okay, and for you, Mercy, again, a lot of decisions ahead of you, but so far you seem to have found your footing to ensure that you stay sane, so to speak. What would you like to encourage others, especially the young ones in this profession?
I think one of the things that I've come to realize is that sometimes you can give your best and it may not what you want. Sometimes you can take care of a patient, you can do your best and still find the patient getting worse, or rather things are not working the same way you thought. Understanding that and understanding that is going to be one step towards having taking care of your mental health.
Yeah.
And yes, and also the people who are older, or rather who are more experienced, should be at least more supportive and extend grace, especially to people who are younger, because sometimes you may fall short in some stuff, and especially some gaps and all that. And so extending a bit of grace and being more understanding is very important.
We hear you, Mercy. And Dr. Lukoye, shortly, because we need to close this, but the issue of mentorship has been brought about by Mercy very clearly. Talk about the importance of the same.
Yeah. So I think what I tell any leader or any professional is that you will be here for a season, and after that season, you'll be gone. If what you're doing is very, very important, who will continue doing it when you're gone? So you have to think about that the moment you begin. And therefore, you have to be very mindful that you look around, find colleagues, younger colleagues that you can mentor, that you can teach to do the same things you do, so that as you reduce your workload, as you transition towards leaving this workplace, there are people who continue doing the work that you do. That is a function of mentorship. If you're very good at what you do, the measurement of how good you are will be how well that work continues when you're not there. If that work stops when you're not there, then you're a failure. If the work continues and is multiplied when you're gone, then you have been an exemplary leader, you have been an exemplary professional. So everybody who is good at what they do must become a mentor to others to show them how to do what they do as well as they do, or even better. And this is good for you because it assures you that you can take a break and other people can continue doing your work while you take a break and take care of yourself. Yeah, that is really the gist of it. Yeah.
Very well said, and I love the fact that it has circled back to how it can actually give you time to breathe, even as you continue to not only offer yourself in your profession, but also your life as a whole. Okay, Dr. Lukoye Atoli, Professor of Psychiatry and the Dean of Medical College, East Africa, Aga Khan University, thank you for your time. Of course, Dr. Ubreen Mora, Consultant Physician and Health Advocate, Eunice Ngare, who is a midwife and also a non-official, thank you for representing. And of course, we have Mercy Minor, who is a nurse who was joining us all the way from Meru County. We thank you for being so candid about this, and definitely more forums need to be put together to have this conversation, because it's okay for the healthcare workers to also know it's okay not to be okay all the time. Right?
True.
Yeah. True. All right. So tomorrow, We focus on the ongoing 16 days of activism against gender-based violence, which started on November 25th and end on December 10th. Now, it is not a secret the cases of sexual and gender-based violence have skyrocketed during the pandemic, bringing to the fore a need to address the gaps in tackling these cases. Join me from 7 a.m. as we unravel the same. See you then.
I am a school teacher.
I am a salesman.
I'm an IT specialist.
I am a hotel CEO. I helped build Kenya's best bank in mobile banking, in agency banking,
in product innovation,
in internet banking.
Equity. Karibu member.